let's talk a little bit about the surgical procedure itself. Even though you don't do the surgery, are you generally familiar with what it involves?
Oh, sure. I don't perform the surgery, but I get the specimen from the surgery, so I'm very familiar with what's involved.
So let's stop here for a moment. Before the surgery, there was already a biopsy that was positive for stomach cancer, am I right?
Yes.
But nevertheless, after the surgery, is there another specimen taken for a, whatever you want to call it, confirmatory test?
Right. So when they took the entire stomach out, the part of the pancreas, they sent that to the pathologist that they had there, and he processed it. So you'd open the stomach, you'd find the tumor, you section through, and you put through pieces that are again going to be put into wax, cut slides, and we're going to look at those under the microscope. And typically we'll look at, versus a biopsy, maybe one slide. A specimen like this may be 20, 30, 40, 50 slides that we look at.
Now again, this pathology work was not done by you, it was done by Ketchum, Wood, and Burgert. Am I right?
Right.
In Tallahassee.
Right.
All right. And what does this pathology report indicate?
Well, so this part of it we have blown up here is just telling us what, we've got some demographic information here with patient's name, birthday, and when we received the specimen, things like that. We've got a little clinical history here of some polyps in the colon that were all benign. This particular, we were talking about the resection, but this is actually the biopsy report. So we just give a gross examination. What you can see grossly is what you can see with your naked eye. So when we receive this, we see that they dictate a receiving formalin, which is the liquid, soft tissue fragments, 1 centimeter aggregate dimension. So a centimeter is a little less than 1/4 of an inch. So there was multiple little fragments. Those are the little biopsies of the stomach lining that were taken through the scope. So we put those in a jar and submitted those for pathology.
All right. And if we can go further on down the report, please. All right. Now, did you have a chance to look at the pathology report? Anything else on this report that is pertinent to your testimony here?
Well, no. So yeah, you fooled me just for a second with the top. So this is actually when they did the colonoscopy of the colon.
Okay. All right.
So these are all, so he's entirely benign in the colon.
Gotcha.
At that point.
All right. So let me ask you this: the imagery that was done after the surgery, were you able to look at those paraffin blocks or cuts?
Well, the resection of the stomach at surgery, no. So again, that was done in '93, and that would also have been discarded probably in 2003 or 2004, 10 years later.
But do you remember what the medical records indicated in terms of whether it was positive or reconfirmation that it was stomach cancer, number 2, the approximate size of the tumor?
Yes. So the pathologist gets the specimen, he opens it up, he measures the tumor, he finds if the tumor may be spread into a lymph node, or and then the most important thing is to confirm that there is tumor there, and to look at the margin. So that's the edge. So where the surgeon has cut around, because we want to know, did the surgeon, was he able to remove all the tumor or not? And so as you lay the specimen out and open it up, you begin to take samples from around the periphery of the specimen to see is there cancer in the edges, was he able to get it all or not? Sometimes they do, and sometimes they don't. The goal is actually to get it all, but sometimes once they get there, it's more extensive than they anticipated, and they may not get it all.
And do you remember the approximate size of this tumor? Was it measured in some way or fashion?
It was. So they measured the tumor inside the stomach was about 10 centimeters by 7 centimeters by 1 centimeter. And so, this little remote here is about 7 centimeters. Again, a centimeter. I grew up using inches, but now in medicine we all use centimeters. So a centimeter is about 1/4 of an inch. So this little remote would be about 7 centimeters. 1 centimeter again would be this thing is probably 2 or 3 centimeters in thickness. So 10 by 7 by 1 would be something like a cookie, maybe. Trying to think of some. Yeah, certainly not like again, if you have to think of it in 3 dimensions, just because you say, well, it's 10 centimeters, well, that's only one direction. A pencil's 10 centimeters, but it's not the same size as a grapefruit, which might be 10 by 10 by 10.
So, first question, and now these are your case-specific opinions. Did Richard as a result of your review of the medical records, and although you didn't look at the slides themselves, you looked at the reports, pathology slides, the reports from the pathology slide examinations done by other pathologists, did Richard Harris have stomach cancer?
Yes, sir.
And when was it first medically diagnosed?
In 1992, late in 92.
And do you have an opinion based on your review of Mr. Harris's medical record as to what was the cause of that cancer?
Yes, my opinion is that his long history of cigarette smoking was a significant contributing cause to his stomach cancer. Smoking is well known to cause increase your risk and cause stomach cancer. There are other things that can contribute to causing stomach cancer as well, but in his case, he had a long, extensive history of smoking and was smoking at that time.